Darj, a dentist from El Paso. Hi, Dr. Darj, how are you?
Hi, Mr. Flash, how you doing?
Good. Dr. Darj, let's talk about dentures. And in fact, I have heard that about 40-some million people in this country wearing dentures. And of course, dentures is a good thing if there's no other option. Most of the people do it due to price and stuff. But nevertheless, they're suffering. The dentures become, they don't become bigger. It's the mouth, the gums become smaller, so they become loose. People use denture creams. People lose their taste spot because the denture is lining up their palate, all kinds of things. And of course are constantly in fear of losing those things when they laugh and smile at a Thanksgiving dinner or something. There is this new thing out there, and it might not be so new, but it's relatively new, and that is called an implant-supported denture. Tell us about it, and tell us, are they really as good as they are cracked up to be?
Absolutely. Implant-supported denture basically uses the same principles as the denture, but there are anchors that go in the jaw. And what that does is when the denture is not constantly moving, the patient's comfort level, quality of life definitely increases. And what's more, it is that it helps support the bone, so your bone doesn't shrink as much as without it.
And those anchors are just kind of like more or less or completely traditional implants who are made in a way that then you can snap on your denture. Is that correct?
Yes, absolutely.
So let's look at the financial point here, because I assume, you correct me if I'm wrong, that most people who need to replace all their teeth, for whatever reason they did wrong or genetically just no avoidance, they use a denture because of money, because putting lots of implants in it is simply very expensive, correct? Can you not hear me?
I didn't hear the last part, Mr. Flash. Would you repeat that, please?
Sure. So people who need a denture, for whatever reason they came to that point, they do a denture versus implant simply because of money reasons, because otherwise they would take lots of implants, costs a lots of money, and a denture is tremendously cheaper, and thus they go that way. But they don't do it out of another choice in most cases. Am I correct there?
Most often, yes, you're absolutely correct. There are cases that simply the anatomy won't allow, even with obtain amount of money, to put all implants and have implant-supported crowns. So we need to go to a hybrid device, which is implant.
I got it. So that's it. So if a person takes an implant-supported denture where he maybe uses 2 implants, 3, maybe 4, obviously as the number slightly increases, as better of a sitting you have. It's like riding a bicycle and driving in a car. The balance of a car is usually a little better than that of a bicycle. So when a person does that, he saves a tremendous amount of money. But the question is this: can he really bite into an apple? Can he chew on a spare rib with one of those implant-supported dentures? Are they that good?
Yes. Yes, they are absolutely that good.
Beautiful. And obviously they look good and all that stuff. And he does not need any denture cream adhesives ever anymore.
No denture cream, no adhesive. That you absolutely cannot tell the difference. Cosmetically, there are a lot of options available to patients. There is absolutely no reason for a younger person or even an advanced in age person to feel uncomfortable wearing dentures, feeling maybe cosmetically that's not adequate, because we can use lots of different shades of porcelain. We can even use pink porcelain to mimic gums. It is indistinguishable.
Beautiful. And the person wearing it will very, very soon realize that, because the people looking at him and even him looking at the mirror and smiling, he will realize I'm looking good, right?
Yes. I've personally had young patients who have lost their teeth to trauma or whatever other reason. Gum genetics, many different reasons. I've had a patient who's a nurse in her 40s, and she was absolutely incapable of running her normal daily routines because of poorly fit dentures. She was embarrassed, but with implant-supported dentures, she's able to function. She's able to laugh and talk and speak, and she is very youthful again.
Beautiful. And what about the able to taste food? Because that's something which denture patients complain about. I think you have a son waiting for you in the back here.
I have a daughter waiting for me in the back.
A daughter? Yes. What does she want? Hello.
I have no idea.
Why don't we hear what she wants?
What do you want, Rox?
I want to buy presents also for Paso.
Yes.
And I have to do my wrapping.
Yes.
I'm just kidding with your wrapping.
Okay, can you please, Rox? I'm in the middle of this. Please.
I'm sorry.
Bye-bye.
I'm sorry.
Okay, bye-bye. Patients who wear full prosthetics do have some issues with tasting food because it covers the whole roof of their mouth. But with hybrid, with implant-supported denture, we are able to relieve some of that coverage because we have support with these anchors, and so the patient can taste food better.
Beautiful. So that's obviously another big advantage, at least I think so, because I like to taste my food. I mean, that's what
most of us, we love food. It's a human attribute, and it's a matter of quality of life. Yes. Well, I've never met a single patient who said, I don't like to taste my food.
Except maybe if they cook it themselves, right? Just kidding.
Well,
So in any case, so basically a implant-supported denture, tremendously cheaper, sturdy, stable, will not fall out, will not give you the feeling of like it's coming out, and you can taste your food. You don't need any denture cream and put that gluey yuck in it, and you look just like you would have implants or crowns or bridges or for that much your normal teeth.
Yes.
Beautiful. Thank you very, very much. Very enlightening, and definitely very good to find out that actually this can be done. Thank you very much. Our grandparents would have enjoyed that.
Thank you, Mr. Flash.
You're welcome.